Hi everyone. We're on to topic 1.2 now. We're going to talk about structuring the relationship. We're going to talk about the therapeutic relationship in particular. So therapeutic relationship, what is it? We already talked about it in Unit 1.1. It's a professional alliance where the healthcare professional and client join together for a defined period of time to achieve health-related treatment goals. So there's always a start and there's an end. It doesn't go on forever. Who can the client be? Well, the client can be a person, a family, a group, community, depending on what kind of healthcare you are giving at the time. It doesn't necessarily just mean a client. Characteristics of a therapeutic relationship. There are 3 components to a therapeutic relationship. So client-centered approach, mutuality and partnership, and professional boundaries. So we're going to talk about each one of those individually. So what is a client-centered approach? Well, your focus on the client requires investigation of the abilities, feelings, needs, and desires of the client to establish goals. You got to remember, the client is considered the expert on his or her life, so they know best about what's going on with them. So facilitates function and empowers a client to participate, thereby positively affecting their health and well-being, which is ultimately the goal of a therapeutic relationship. We want to get that client to the best possible healthcare we can. Involves effective listening that adapts to the particular individual and their context, their nonverbal cues and context. I should have fixed that in there. Positive emotions and outcomes and a mutual understanding of the characteristics of therapeutic relationships. So the key to a client-centered approach is purposeful thinking behind your actions. So you don't do something just for the sake of doing it. You do it for a reason. It's happening. So it includes respecting individual values and preferences, beliefs, involves the coordination and integration of care across the whole boundaries of the system. So you're going to bring a client or a patient into emerge. You're not just going to drop them and leave them. You're going to make sure they're well taken care of. Provides the information, communication, education the client needs and wants. And you're going to guarantee the physical comfort level, emotional support, and involve family and friends, because they are very, very important to this client. And this approach is going to be different for every client you deal with, because even if a client has the same diagnosis as the next, you're going to treat them differently. Everybody's a little different. So mutuality and partnership talks about client empowerment and self-determination. So what does mutuality and partnership mean? Well, it means we work together with a client to agree on the client's health issues and how we're going to resolve the issue. You're going to go into a home, you're going to deal with people. You're not going to be allowed to take over. You actually have to take into account their needs. So by empowering them, empowerment's defined as helping people develop the knowledge, skills, and other resources they need to set their own health agendas and take the primary role in healthcare. Ultimately, in all healthcare, we want the client to become the driving force behind their healthcare. We want them to take ownership of it. There is more emphasis on increased client participation in care. Full client and or family involvement is an essential component of effective clinical decision making. Clients are expected to be active partners in their own health care. We want a collaborative care nowadays. And then self-determination. The client always has the right to choose personal goals and courses of actions. We don't have the right to impose what we want them to happen. So you could go into a home and this client is going to need X, Y, and Z. However, they're going to say to you, no, I want A, B, and C. And unless they're not in their full faculties, you have to do A, B, and C as opposed to X, Y, and Z. They have the right to autonomy, the quality of having ability or tendency to function independently. They have the right to make their own decisions. And we have to take that into consideration. Professional boundaries requires boundaries to prevent relationship from becoming personal. Requires trust, empathy, respect, and our interactions are all goal-centered. We're not just doing it haphazardly. The healthcare provider desires to share their knowledge, skill, and when required, comfort to support and facilitate function and participation in life. Professional boundaries in a therapeutic relationship represent invisible structures imposed by legal, moral, and your professional standards that respect both your rights and the client's rights. So your governing body guides you in how you deal with these kind of things. So examples is the setting, the time, the purpose of your visit, the length of contact, confidentiality, use of provincial boundaries. So boundary violations, sorry, I'm getting stuck on my tongue here. So violations take advantage of the client's vulnerability, either sexual encounters, personal business relationships, accepting gifts, totally unacceptable. Boundary crossings, less serious. They give the appearance of impropriety, but don't violate any ethics. So it's extra involvement with your client. It's, meeting them outside your relationship. Things that really, that's why we have professional boundaries, to keep you safe and to keep the client safe. So what's our role as a healthcare professional? Well, to educate, to advocate, to empower, to listen, to collaborate. I'm sure you can come up with many more. Those are just a few. Is there a difference between a therapeutic relationship and a personal relationship? Well, of course there is. But we want to keep the two mutually exclusive in a therapeutic relationship. So personal relationships are based on mutual affection and familiarity, not goal achievement. You're hanging out with your buds. That's a personal relationship. Boundaries are freer. You visit each other's home, the family. Emotions are expressed freely from both sides on any topic they choose. The needs of each participant are equally important to the relationship. So there are 3 phases of a therapeutic relationship, and Alberta Health Services has a lovely therapeutic relationship module, and you can access it on the Moodle page. So the 3 phases are orientation phase, working phase, and resolution phase, which is the termination phase. The orientation phase, you're getting to know each other. You trust each other. Trust, respect, honesty, effective communication, acceptance, consistency, and active listening are very, very important during the stage. They're sizing you up just as much as you're sizing them up. Expectations are clarified. Priorities are established. Clients prepared for the inevitable end of the relationship. Even in the orientation phase, you're going to start talking about when this relationship's going to end. Just preparing them for the eventuality that it is going to end. The working phase, that's when all the interventions happen. That's the nuts and bolts of it. Ongoing assessment of the client becomes more self-directed. They're taking control of their healthcare or their healthcare decisions. And then finally, the resolution. So ensure needs are met, celebrate achievements, allow client to share feelings about loss, because if you've dealt with this client for a while, and in your field you may not deal with them for too long, but they may get slightly attached to, and validate future plans. How are they going to meet their needs in the future when you're not around? So factors affecting a positive therapeutic relationship: personal beliefs and values, culture, stereotyping, which you really don't want to do, personal agendas, inappropriate boundaries, and we talked about professional boundaries, professional jargon. You want to keep your communications at a level they're going to understand and level of understanding. Now, we use a lot of therapeutic techniques, and we're going to talk more about those in further units. However, we're just going to quickly talk about questioning as a use of intervention, therapeutic intervention. How do you get information out of your clients? How do you find the best possible answers? How do you get your answers? Well, we use different strategies to develop a therapeutic relationship. We can get a lot of information from our clients with the effective use of questions. So let's just go through those. So closed questions. Used to get discrete information. Yes, no, one-word answers. Good when you need information quickly. Example, emergency. Are you bleeding? No. That kind of thing. Maybe used to give a list of options. Sit up, back, lay down. Maybe perceived as threatening because you're taking control. So just be careful. But in an emergency situation, you are more than likely going to have to use these kind of questions. Open questions. No right or wrong answer. You're searching for information. Client has control of the answer. Healthcare professional listens, observes, learns. Sometimes, I talked about in unit 1.1 about the verbal matching the nonverbal. Sometimes when you're interviewing a client, you're going to see their nonverbal doesn't match their verbal, and you're going to be very skeptical about what they're saying. And it's all right to kind of bring that up when you're talking to them. Open questions are less threatening. They're used to explore or elaborate on a subject. Probing questions. So you want more information about a particular topic. So your client's having chest pain. Let's assess your pain level. Does it radiate? Be more specific. What kind of pain is it? You're probing. You want more information. You want them to provide specific details and deeper insight. Change or return focus to an earlier point in conversation. So you're going back to question them on a point they've already talked about because you want more information. May feel interrogating if overused. But if you're doing it the right way, people are more than happy usually to give you as much information as you want. Clarifying seeks understanding of client more than information. Enhance mutual understanding. You want to get to know them a little bit. Leading questions tells the client what the right answer is right in the question. Pressures client to respond the way expected. May be useful if the subject is not the client, example the weather, create a common link. But you don't want to do this. So there's times when we want the answer to be a certain thing or just automatically expect it to be something, and we're kind of lead them. Let me think of an example. For example, maybe you just gave a client with acute back pain 10 milligrams of morphine IV. It's a large dose at once, and you expect them to be flying high as a kite. So you go in asking, "You're not in any pain now, are you?" Well, that's a leading question because, they could be tolerant to that kind of medication, and they may very well still be in pain. So try not to do that. So 2 things to always remember. These are interventions encouraging versus discouraging responses. So encourage responses, focus attention on the person, acknowledge their emotions. They are the most important thing in this conversation. Indicate that in this situation, such emotions are common. Indicate without a detailed description that the health professional has some understanding because of a similar experience. But you do not go too far into that. Ask for clarification of the emotions and the cause. So discouraging, state there's no need to feel the emotions. You brush them off. It doesn't work very well. Acknowledge the emotions but change the subject. Again, you've just told them that their emotions aren't important. If you continue to interrupt or to avoid hearing the expression of such emotion, totally ignore the emotions. Never tell a client, "I know how you feel." It's arrogantly presumptuous. Never tell a client it's going to be okay or you're going to be all right. How do you know things are going to turn out right? What evidence do you have to say this? This response just minimizes their feelings and tells them they shouldn't feel that way. In general, it's better to seek more information on how they're feeling, acknowledge your emotions, and then paraphrase their responses to validate your understanding. Throw back at them what you think they heard, and then they're going to tell you whether or not you were correct. Being able to express and explore negative emotions is important for a client. Unfortunately, it's not always a comfortable process for you as a health professional who has to hear about them, which is why self-awareness is so important. So negative emotions make us uncomfortable. We remind us of something that's happened to us in the past. We may feel a really strong connection to that. And we're busy. We've got other priorities. But self-awareness makes us realize the ways we may be hindering the progress of a therapeutic relationship. So, it's really, negative emotions really can make us uncomfortable. It may be a natural response to want to get rid of them as soon as possible, to offer easy reassurances, but try hard not to do that. You want to build a therapeutic relationship that has a client trusting you and giving you the answers you really do need at that time. Well, that's the end of topic 1.2. So now on to 1.3.